Central Illinois is the CI in CI Living.
When your forever friend experiences health issues, you will do anything to help make them better. And joining us in today's Forever Family from the University of Illinois, completing her 3-year residency in veterinary cardiology, we have Dr. Sumana Prabhakar hanging out with us. Thank you for being with us.
Thank you so much for having me.
Okay, let's talk a little bit about this new clinical trial that you guys are getting ready to have there at the University of Illinois. What's it all about?
Yeah, great question. So we're really excited about this new clinical trial. Thank you for prefacing that. It's looking at one of the most common cardiac diseases we see in our dogs. It's called dilated cardiomyopathy. Now, what happens with this disease process is with time or with genetics, something underlying happens in the actual heart muscle that causes fibrosis, scar tissue buildup, and overall just thinning of the heart wall.
So we don't really know what causes this?
There are a few different ideas we have. So there's some genetic mutations that have been identified in specific breeds. We think of our Dobermans, our big breed dogs, those big guys that like to lug us around. So Dobermans, the Great Danes, the Newfoundlands, guys like that. But it's also become a very, very relevant disease process lately because very recently, within the past few years, we've associated this disease process with some of our boutique diets out there. So as you or I become more conscious about our health, a lot of our pet owners are also becoming more conscious about their dog's health. And with the different trends that are there available with our diets, similar markets are being there available for our dogs as well. So we're seeing quite a bit of the nice, like the chickpea, the lentils, the grain-free diets. And with that emergence of that diet, we've actually seen quite a bit more of this DCM.
Wow, that's interesting because you think as a pet owner, you're trying to do the best thing for your pet by giving them this great diet, and then it could be backfiring on us. Okay, so that's kind of the cause. Yes. What kind of symptoms are we going to be looking for to think, ooh, they may be having some heart issues?
Yes, good question. So very commonly this disease, it can present with, it's a disease process where the heart's just not contracting as well as it should be. So you're not able to perfuse the rest of the body as well as you should, and as a result, it makes these guys feel really crummy. They're lethargic, they don't want to eat. Exactly.
So what is this? This is a normal heartbeat or an irregular?
This is an irregular one. So this is a great example of a dog that's affected with DCM. You can see the heart's really globoid, it's round, it's not contracting as well as you'd expect. And in this case, you're even seeing a secondary arrhythmia that was occurring in this dog. So that arrhythmia, that abnormal blood flow, that decreased actual perfusion to the rest of the body, all of these are things that can make these patients feel really overall crummy.
Now, is this a death sentence for a dog, or is this kind of like this clinical trial is kind of like a little extra glimmer of hope?
That's a good question. So that's exactly why we're kind of pushing for this clinical trial. This disease process, it's really scary for our owners, and it's really it's hard for us to also kind of diagnose this in our patients because there's no cure for it. The way we manage this disease process is with medications, just to help the heart do a bit of a better job as much as we can. So on top of those medications, this clinical trial is looking at a specific additional medication. It's called rapamycin. It targets some of those pathways that actually promote the aging mechanisms of the heart and actually throughout the entire body.
Oh, wow. Okay, now, if somebody is out there and they think, or maybe they already know that they've got this diagnosis, what's the best way for them to learn more, maybe to participate and get involved?
Yes, great question. So the best way is to give us an email. So contact us. The email is VT.
We'll have that on the website, so I don't have to waste your time with that.
Perfect. Well, yes, please email us and let us know, hey, we're interested in the repair study is the name of the study.
Okay,
and through this study, we'll be able to offer these dogs, it's a 6-month study, we're able to offer them gold standard screening, so echocardiograms, Holter monitors, chest x-rays, blood work, these things that normally can be quite a bit out of pocket for for, we're completely able to cover. Not to mention that gold standard therapy of pemobendin, the medication that we use to treat a lot of these patients for, we'll be starting that for them, and we can cover the cost for the entire 6
wonderful,
months.
because I know a lot of pet owners out there, they want to do anything they can to make sure that their animals have a good quality of life, and then if we can add the quantity, even better. So thank you so much. Exciting things happening there with the University of Illinois. If you want that email address to get in touch with them and participate in this brand new clinical trial, we will have all of that information at our website, CILiving.tv.